forward. All right. Thanks so much, Rebecca, for agreeing to come back on the podcast. I can't believe it's been a long time since you were here on the podcast, but I'm really excited to have you back.
I'm so excited to be back as well. I know your podcast has grown a lot in the last few years, as has ours at ED.
Yep.
So it's fun to be able to collaborate again.
Yeah, I think lots of people, if they listen to my podcast, they listen to your podcast. So they seem to work well for folks together. So why don't you start off a bit by telling us a bit about yourself and your work and your family, if you'd like.
Sure. So my name's Rebecca, and I got into the birth field after my second baby was born. So when my first was born, I was a nurse getting my PhD in nursing, and I gave birth at an academic medical center. And at the time, I just really wanted to be a good patient. I wanted the nurses especially to like me. I had a great relationship with my OB, and she was going to be the one who was present at my birth. So I felt really fortunate with that. But how my stay itself in the hospital was managed was just really surprising to me. The way I was told I was not allowed out of bed, I was kept on the monitors the whole time, not allowed to eat or drink or even have ice chips at the time. And because I had a long labor, the nurses, nobody ever suggested I reposition. So I laid on my back in bed for the whole 24 hours, including while I was pushing my baby out. And I pushed for 3 hours and ended up needing both the OB to use their hand to manually turn my baby's head, as well as a vacuum, for several reasons. One, I was exhausted. Two, my baby was in a less than ideal position, probably because I'd been laying on my back the whole time. And third, the epidural had numbed me so much that for the first couple hours that I was pushing, I wasn't really doing anything. And then that exhausted me. And then the third hour. So she was born with the help of a vacuum and then immediately taken away for observation. And I didn't get her back for another 3 hours, even though her APGARs were normal. And that really bothered me. That was the part that bothered me the most. Like all the restrictions, the not eating was really frustrating, but I could put up with that. It was having my baby taken away that for me was, the hardest part. And the part that made me a year later, like a lot of people do, I think around the 1 year anniversary of giving birth, you start to think about your baby's birthday. You start to have some flashbacks and you just start, musing on it. And so I started questioning everything that happened. To be honest, I didn't really question anything until that happened. Can we pause for just a second? Someone came to the door and there's a lot of noise in the...
Sure.
My dad comes over every day to help, and he's at the door.
No worries. I couldn't hear anything if it makes a difference. So
it's just a little distracting.
Gotcha.
Okay. Well, if you can't hear anything, we can go on.
Okay. Totally up to you.
Okay. Let me get back to my mindset. Hold on. They're almost done.
Yeah. No problem. Give me a second to take some more sips of coffee.
Yeah, I'll take it. So I made a list of everything that happened to me, and I started looking up the research evidence. And I was sort of surprised to find that even though I was giving birth in like what was supposed to be a cutting edge academic medical center, a lot of the things that the nurses told me I must do or I was not allowed to do were not healthy for me or my baby. And obviously taking your baby away, there's no evidence to support that. It can interfere with breastfeeding and bonding. And then with laying on my back the whole time, and that's, I know what we're going to talk about today.
Right.
There wasn't even the slightest suggestion that I turn to my side. And because I had an epidural, I was just completely motionless from the waist down. I couldn't do anything without help. And they dosed it too high, I guess, because I know with a low dose epidural, that's not necessarily a problem.
Sure.
So I started looking up the research, and then I decided to have a completely different experience the next time around. So my first baby only weighed 6 pounds, 8 ounces. And as you can see, it took me 3 full hours to push her out. My second baby I had with the help of a midwife, and I pushed him out in 10 or 15 minutes, and he weighed 9 pounds, 2 ounces. So you can see how, like, you know, I did everything differently the second time around, and it made a huge difference, in particular, like how my baby was positioned, what positions I used to help my baby get in a better position. And a lot of what I used was the upright birthing positions, which we're going to share about today. And after that, I went on to start publishing this research on my blog, Evidence-Based Birth, and kind of the rest is history.
Yeah.
Because people really wanted that information.
Yes, absolutely. Absolutely. And of course, we'll link Evidence-Based Birth in the show notes and everything. But you all, Rebecca takes she and her team take a very deep dive into evidence and present a balanced, they present what's there. So it's not biased. It's very, very unbiased information, something that I have gone to many times. So I certainly appreciate your work. So let's start with defining what are the various birth positions in general.
Okay, so there's a couple different ways that researchers can classify positions. So whether or not you are upright or not is one way you can classify. So upright would include standing or squatting. You might be supported by a partner or a prop. Kneeling upright or on your hands and knees is considered an upright position, as is using a birth seat or a birthing stool. Dancing is an upright position that you can labor in as well. And then lying down positions medically are typically called recumbent or semi-recumbent. And those include lying on your back, which the medical term for that is supine. If you're lying on your back and the head of your bed is elevated, then this might be called semi-sitting or semi-recumbent. And that's what I picture the position I was in for my whole labor, where the head of the bed was raised, but I was lying there.
Sure.
And then the lithotomy position is also a lying down position. That's when you're lying on your back with your hips and knees flexed, your thighs apart, and your legs are either supported in stirrups or by people holding your legs in the air. And with that, your head of the bed can also be raised. And then another thing that's interesting is the side lying position is technically a lying down position as well. But that is considered to be a more beneficial lying down position. And so another way you could categorize positions is whether or not you have the weight on your tailbone. So the body weight lying on the sacrum, that's the large kind of plate at the bottom of your spine towards your pelvis. And then you have the tailbone, which makes up the bottom tip of that. So some positions like kneeling, standing, hands and knees, side lying, squatting, and using a birth seat, that sacrum can flex because it's not being like pushed into one position. But if you're lying on your back with or without the head of the bed raised up, or if you're semi-sitting in bed or in the lithotomy position, typically that sacrum is going to be less flexible. So they've done some like computer simulations and MRI studies, and they have found that when that tailbone is allowed to move freely, it can move nearly 16 degrees, which can make quite a difference for the baby's head to be able to come out. And there's been consistent research that when you take the weight off of the tailbone and allow the pelvis to make more room, it makes spontaneous birth without the use of surgery, vacuum, or forceps more likely. So those are kind of like the different categories you can look at.
Sure. That's an excellent overview. So when we think about people, or when we know about people in the U.S., how do most people in the U.S. give birth?
Okay, so, and it's not just the U.S. This is a problem in many countries around the world. It's thought that most healthcare workers around the world encourage people to birth in back-lying or semi-sitting positions for the convenience for the healthcare worker. And there's been studies on that in the U.S., but also India is another example of a country where most people still use lithotomy as the most common position with your feet up in stirrups. So I think in the U.S., it's about 68% are lying on their backs, and another 23% are in a semi-sitting position. So both of those are considered the recumbent or lying down positions. And when you're looking at hospital births, the last data we have on this, unfortunately, is from 9 years ago, but only about 3% were using side lying, 4% were using squatting or sitting, and 1% were using hands or knees. Now, if you contrast that with freestanding birth centers or home births, and you talk to a home birth midwife, they'll often tell you, like, it's very rare for them to see anybody spontaneously choose a lying down position when they're at home or in a birth center. When someone has freedom of movement and they feel comfortable in their environment, they almost always will instinctively choose an upright position or a sacrum flexible position. Now, there's some people, for whatever reason, they feel more comfortable pushing on their backs, and sometimes that ends up being chosen, but most of the time it's not.
Right. And as you said, this is mostly due for convenience of the attendant at birth.
And convenience can mean a lot of different things. So it's more convenient to do fetal monitoring with the belts if someone is in bed on their back. It's more convenient because that's how most healthcare workers are trained. So even when they simulate birth with mannequins, they're doing it with the mannequin on their back. And so a lot of healthcare workers feel uncertain or afraid if somebody's on their hands and knees, for example, because they feel like the birth is happening upside down. Like they haven't been trained to see a head emerge from that angle. And so when the head's coming out, they're kind of like, wait, where's the baby? Like, what's going on? So it's less fear-inducing for the healthcare provider. And then if you have an epidural, it's obviously more convenient for the patient to be on their back because it's harder to move them around, especially if there's a high-dose epidural. And then there's just a lot of importance placed on having the patient in the bed so that you can control or manage the delivery. So all those factors kind of come together to make it seem like a no-brainer in most hospitals. This is the way we do it. This is easier for us. And in their mind, because it's how they see birth happen, like they feel like they can handle complications better in that way.
Sure.
Whereas an upright birth, like say somebody's standing at the side of the bed and their baby's coming out while they're standing on the hospital floor, like that seems really risky or scary, plus inconvenient.
Sure. Yeah, absolutely. But however, as you said, research shows that for people, and I guess I don't know if we should qualify this, without an epidural or unmedicated birth, most often people will choose an upright position. Is that fair to say?
I think so. In some countries, they might choose lying down or semi-sitting because they know that's what's expected of them. So in some of the guidelines for midwives and providers who are trying to support upright birth, they often say sometimes you have to encourage people to do an upright position simply because that's all they see in the movies and on TV is women giving birth on their back, and they just assume that that's how it has to be done, and there's no other way to do it.
Sure.
So yeah, I think if somebody is kind of trained in that mindset, yeah, they might choose that position because they think that's what they're supposed to do.
Yeah, that makes sense. So let's go through the different birth positions, and I actually first want to start with because you've talked about this on your podcast and in your work about the specific dangers of the position that most often people give birth in, or very frequently give birth in the U.S., the dangers of being in lithotomy and stirrups.
Yeah, it's interesting because you can frame it in two ways. You can frame like the benefits of upright positions, or you could talk about like the risks of the non-upright positions. And I think that the lithotomy is a really interesting position to examine because it's gotten to the point where it's still probably one of the most common birthing positions used around the world, but it's considered to be so dangerous that researchers won't include it in studies anymore. So in one of the largest reviews ever published on this subject, when they're looking at people without epidurals, and they actually exclude any study that used the lithotomy, and they the authors were Zhang et al. They wrote, quote, "These horizontal positions can have serious negative effects on maternal health and are not recommended by many international organizations." And then when you go to people with epidurals, there is a lot of recent research on lithotomy finding that it can be quite harmful. And one of the ways that it's harmful is, first of all, it can be more painful.
Mm-hmm.
Second of all, it is considered unethical because it is like a restraint, because you can't really get out of that position if people are kind of like holding your legs or your feet or in the stirrups and everybody's surrounding you.
Sure.
But also the perineal integrity. So the perineum is a diamond-shaped area of tissue between your legs. And when you have a lithotomy, you're much, much more likely to have a severe tear or to be cut with an episiotomy, which can be equivalent to having a severe tear in some circumstances. And so if you want to, lower your chances of having a severe tear or an episiotomy, the most important thing you can do is to not give birth in the lithotomy position. It leaves you too exposed to interference. And when healthcare workers interfere when there's no medical need to interfere, that's when you're having lots of like preventable complications.
Sure. Okay. That makes sense. That definitely makes sense. So let's talk about some of the other birth positions and the evidence about those. And I think it's helpful to separate out into without an epidural and with an epidural, because it can be different, and your options for what you can move into are different. So let's start with without an epidural. What does the research show about benefits, and even if there are any potential risk of different birth positions without an epidural?
Okay, so the study I referenced earlier where they excluded the lithotomy position, that was done by Zhang et al. And published in 2020. They have 12 randomized controlled trials with about 4,300 participants, and they separated everyone into those who are randomly assigned to be upright versus those who were assigned to be lying down, which lying down included semi-sitting and side lying, but they ended up scratch that. Upright included semi-sitting, but they actually didn't have any studies with semi-sitting in it. So basically we had like walking, standing, leaning, using a birth chair, squatting, and kneeling versus lying down or lying down with the head of the bed raised up. And they found that you're much less likely to have forceps or vacuum used on you if you're upright when you're birthing. Your active pushing phase is going to be shorter, especially if you use squatting. That shortens it by more. There is a really substantial decrease in the risk of having severe trauma to your perineum, that tissue integrity that we talked about earlier.
Yeah.
And there's no difference in blood loss between upright versus lying down. And there was a higher risk of having what we call a second-degree tear if you were squatting or sitting on the birth seat. And they think that's probably because there's a trade-off between like you're less likely to have an episiotomy, but you might be more likely to have a first or second degree tear, which is considered to be better than having an episiotomy. So it's a little bit of a good trade-off, they think. In terms of episiotomies, we're not really sure because every study, the episiotomy rates are so different. Like in some hospitals, episiotomy rates are like 0%, and in some hospitals, it's like 100%. So it's really hard to tease that out in a review. But other researchers have also found that in individual studies, one of the benefits that people don't think about is that it's significantly less painful to give birth in an upright position, which of course, if you don't have an epidural, is important.
Sure.
There's also at least one study that's found you're less likely to have the shoulders get stuck when the baby comes out. You're less likely to need an emergency cesarean or to have abnormal fetal heart tones, which makes sense physiologically because if you're lying on your back, you're compressing the aorta, which is the large vessel that brings the oxygenated blood to the fetus. So if you're upright, you're getting the full blood flow through your body.
Absolutely. Now, when we look at where these studies are done, how many of them are in the U.S., and how do you feel like the studies apply to our population?
Okay, yeah. So with that one, the Zhang study took place in the United Kingdom, Finland, Brazil, China, Ireland, Turkey, and South Africa. So there were not any studies done on this subject in the U.S., But like I said, the whole concept of birthing positions is a global issue. Like in some areas, you'll find that upright positions are still quite common, but in many countries, because the Western model of care has kind of spread around the world, it's very common for people to lie on their backs. I think the main thing that's hard to generalize is the use of episiotomy. And so that, like I said, that's why they can't really figure out the episiotomy rates, because it's so dependent on the provider and the hospital.
Yeah. It's interesting to me, though. I know some of the studies show, like you said, really high episiotomy rates. And it seems, I don't know what the, like, conflicting in a way that, like, on the one hand, you know, you're comfortable supporting upright birth, but then you have like a, 70% episiotomy rate. That just seems to sort of conflict with, with what you would expect.
That so much of medical practice is cultural and training. So if that was what was modeled to you as a provider, and it's what you've done your whole career, it's really hard to hold back from doing something that you were taught was helpful and you thought you were doing good all that time. It's really hard to all of a sudden be like, oh wait, hands off. I don't use the scissors. Like, I can just see it's like a paradigm shift, and you're not going to see that everybody being able to do that. And that's why I think upright positions, some of the reasons you still see episiotomies is because in some of these studies, they will maybe allow you to push in an upright position, but then they make you get on your back for the delivery.
Sure.
And so you have to kind of look at each study individually when you're looking at episiotomy rates and be like, all right, did they make them get on the lithotomy position for the moment of birth? And very often that's the case.
Gotcha.
So we don't have a ton of good quality research where people were permitted to follow their urges and push in whatever positions they want. And that's another problem with these studies is nobody really wants to just like push in one position, right? Like you might be on your back for a little bit, then get up and then move over, like especially if you don't have an epidural. So it can be hard to like put numbers and statistics on things. But
sure,
I don't know if you would agree as a provider, but I think it would be harder to cut someone if they were standing.
1000%. Yes.
Okay.
Like, yes. Like you have to
be able to visualize what you're doing.
Yes. You can't, it's absolutely true that if someone is in an upright position, you just can't intervene as much because you aren't able to be in a position to do so. So I absolutely agree that is the case. Yeah.
And I think that's one of the problems though that we face is that I've seen more and more nurses and OBs become more comfortable with the idea of letting someone push in whatever positions they want. But when it gets close to delivery, then they want the patient in the bed on their back. And that erases some, but not all of the benefits, because you still get the benefits of a shorter pushing phase, baby's in a better position, you have less pain.
Right.
But then by making them get on their back, that introduces the risk of either more severe perineal tears or an episiotomy.
Sure.
Or more pain.
Right.
So,
right. I mean, I do think, or I know that we certainly in the U.S. have come a long way in terms of episiotomy rates, and they're actually pretty low, but it's still very much so provider dependent on what happens. So it's certainly different factors to consider. And the culture, your point about cultural practice is really, really, really important. That you can be in a place that, we support upright birth, but we're so used to doing episiotomy that's what we do. Same thing happens in the U.S. People do what they are trained to do and what they see around them. And we very often practice in silos where we don't see other options for what can be done. And cultural practice plays a huge role in people's experience. Yeah. So then let's talk about birth positions with an epidural. What are risk benefits, the things around birth positions with an epidural?
So we don't have as much good evidence on this. There's one really large study that kind of like dominates the research on this topic. It's called the Bumpies trial, or Bumps. I don't know how they pronounce it. It was done in the United Kingdom. And that one, they were comparing upright versus sideline positions with an epidural. And if you had to guess, which one do you think would be more beneficial?
I would say upright, but is it side lying that's most beneficial?
Yeah. So interestingly, they found the side lying position to be more beneficial. Now, they were not using any back lying, semi-sitting, or lithotomy positions. The upright group was either on foot, standing, sitting, or kneeling. And then the non-upright group, the side lying group, they were side lying with the head of the bed raised up 30 degrees. And most of these people had really low dose epidurals, so they were able to move around pretty freely, unlike me when I had my epidural.
Sure.
And they found that fewer people in the upright position had a spontaneous vaginal birth. It was 35% of them had a spontaneous vaginal birth versus 41% in the sideline group. But the problem with this study is that the rate of vacuum and forceps was more than 50% in both groups.
This is so perplexing to me.
I know.
Like, because that's just not common. So
yeah, it's another cultural thing, right? So we have very high cesarean rates, whereas another country might have very high vacuum and forceps delivery rates. So it's not really clear. I really don't think that we could use this study to truly generalize like the findings. Both are probably acceptable, both upright and side lying positions. I did find 2 other studies on the lithotomy position with epidurals, and they found, like I mentioned earlier, that the lithotomy position had many more risks than any other position.
Right.
So there are some other smaller studies on that subject. But yeah, we don't have a lot of research on that. We do have one other study, though, on using birth seats. And for your listeners who aren't familiar with that, you can Google different kinds of birth seats, and I have a video on our YouTube channel that kind of shows the different types of birthing stools. I can send you that link.
Sure.
But there is one study on using, often these birth seats are like U-shaped, and they make room for the tailbone to still be flexible while you're kind of sitting on them. And then the provider can kind of access the baby coming out through the front, the U part. And the researchers, these were in Sweden, they had more than 1,000 people giving birth for the first time. And about half of them had epidurals, so half had epidurals and half didn't. And they found that using a birth seat led to a shorter pushing phase, less use of Pitocin, and fewer episiotomies. There was, however, a slightly higher risk of losing blood postpartum, but this did not affect any long-term outcomes. And there was no difference in the rate of forceps or vacuum assistance being used. But one of the interesting things about the study is the participants were more likely to report, if they used a birth seat, that they felt powerful, protected, and self-confident. Which I thought was interesting. A lot of time in these research studies, we just have statistics on different health outcomes, but nobody actually asks people what was your experience?
How do you feel?
Like?
Yes.
Yeah. So I thought that was really, it's really cool to know that something as simple as having these special birth seats can make such a difference in your satisfaction and how you feel about yourself as you're giving birth. And I still have found it's not that common where I live in Kentucky, unless you bring your own birthing stool. They're not widely available where I live.
I haven't. I mean, I've worked in several hospitals during my career, and I've seen it in one, but even people using them, it's not very common. So yeah. I agree. Yeah. I have never attended a birth with someone on a birth stool. Certainly done in upright positions, but not on a birth stool. So it's not very common.
Yeah. And there are ones you can bring that are inflatable, and there's plastic ones that can be easily sanitized in between patients. So it doesn't have to be just like the old-fashioned kind of wooden stool, which there's a long history, though, of wooden birthing stools. I mean, it goes as far back as the Bible. There's a Bible verse about midwives, attending to the Hebrew women on the birthing stool. So it's a very ancient practice, and there's probably a good reason for it that a lot of people have been attracted to it. But again, it goes back to culture. As culture shifts and people don't see it anymore, they think it's this outlandish, weird thing.
Right.
When it actually is, something that's been passed down through the ages.
Absolutely. Kind of similar with midwifery, actually. All right. So the reality is that, especially here in the U.S., that most people give birth in the hospital, which often or is very likely going to mean giving birth, or at least nurses wanting you to be on your back. So what advice would you give to someone who's having a baby and plans to give birth in the hospital about trying to navigate that reality?
Yeah, I think it's important to be upfront and honest with your healthcare team about your birth plans. So if you want to give birth in an upright position, you need to start having conversations with your healthcare provider, and you need to bring up the difference between upright birthing positions during pushing and during delivery. And I don't usually use the word delivery, as I have a book called Babies Are Not Pizzas, They're Born Not Delivered, because delivery is a very passive term. I think it gives the power to the provider instead of the parent. I prefer to say like when I birthed my baby instead of when the doctor delivered my baby. But that's the terminology that most doctors use.
Yeah.
And that makes it really clear. Like, what positions do you attend births during the pushing phase? What kinds of positions do you support as a provider during the actual delivery? And I would probably use that exact phrase, the actual delivery, to find out like what is their comfort level? Because if this is really important to you, it's important then to find a provider who is comfortable with it, because a lot of providers who are not familiar with upright birth have a lot of fear associated with it, and they will come up with an excuse most of the time to try and get you on your back, not out of some malintent, but because they're nervous and they don't feel safe. And so most midwives, I would say, can support an upright birth because they're trained in it during school. Not all do it as a normal practice, but kind of finding out where what that looks like with your provider and the providers in their practice.
Right.
So if you don't know which provider is going to be at your birth, like find out, well, what about your colleagues? How do they like to support the actual delivery? And if you really want to give birth in an upright position, you might have to switch clinics in order to get that. Because like I said, they can't force you on your back, although there are documented cases of people being forced on their backs. That is like a form of battery. But there's a lot of psychological pressure that can be put on you at the last minute. So if it's important to you, that's what I recommend, is finding out what their typical practice is and then deciding, is this a negotiable for you or not? Like if you don't mind, if you're okay with pushing in an upright position and then getting on your back for the delivery, then that's great. But if it's really important to you to say you're having an unmedicated birth and pain control is very important to you, like getting on your back for the delivery might be incredibly painful. So thinking about what are your wishes and what's negotiable and what's not. And and if you're giving birth in a freestanding birth center at home, it's typically not going to be an option. It just and you can ask doulas in your area. If you have a doula, ask them, what have you seen with the providers from my practice? Like, do they support upright birth and delivery or not?
Absolutely. And waiting until you get to the hospital and handing someone your birth plan is entirely too late.
Yeah. I mean, technically they should respect it, but also one thing you can do is ask for a nurse when you get there who enjoys unmedicated birth or upright birth. Another thing you can do to make it more likely that you have upright pushing positions is there are a few hospitals that support water birth as an option. And in water birth, you almost always give birth in an upright position. So that's something else that can enhance the likelihood. Also making sure that if you're going to have fetal monitoring, that they have wireless monitors, things that make it easier for you to be mobile during both the laboring phase and the pushing phase. Those are all things that can help if
Sure.
that's one of your goals, to have an upright birth.
Yeah. And I guess as we wrap up, I think of it this way, that you don't have to give birth in any particular position. The key is that you should have all of the options available to you. So you may find that you want to be on your side. You may find that you want to be on hands and knees. You may find that you want to be kneeling. Occasionally, people, like you said, may want to be on their back, but you shouldn't be forced to do any one way. The key is that you should have the options available to you.
Right. It's and if for some reason you end up with a provider who's not supportive of your wishes, that's where you want to have an advocate or two with you who can help speak up for you, because you're in a very vulnerable situation as the baby is literally emerging from your body. So if they're like, you have to get on your back now, but there's no true medical reason for it, having a partner there who could be like, no, she's staying right where she is, like,
Right.
can make the difference for you. And knowing that somebody is like speaking up for you when you're in the middle of a contraction or pushing
Sure.
and you can't.
Sure.
Yeah. And I agree. Like, I have talked with people who have said, I ended up on my back and that was the most comfortable position for me. And I think it's important for people to know, like, it really is about your choices and your wishes. That's the whole point. The problem is when we have a norm where everybody's expected to give birth on their back, it's the people who don't want to give birth on their backs that have the hardest time achieving that goal.
Absolutely.
So,
yeah. So I guess sometimes I just see people see, like, I'm not supposed to be on my back. I'm not supposed to be on my back. And it's like, that's not what it is. It's really that you are supposed to be how you feel most comfortable and what feels
Right.
natural to you, whatever that may be. So keep your, listen to the instincts of your body and get in the positions that you feel work best for you. And then as the people attending the birth, should absolutely support that. The nurses should support that. So
Yeah. And I think if you go back to like my story and how I laid on my back for so long, at the very minimum, you need to be shifting your position at least every 30 minutes, unless you're
100%.
asleep. Yeah.
Yeah. And how old is your child?
Oh, so she is 14 years old. So
Okay.
she is a young teen now,
Okay.
but it definitely feels like it was yesterday.
Sure.
And I know it's still a problem.
Yeah, it is.
In my town.
Yeah.
So it's not like it's gone away. And I have not worked myself out of a job yet, but I keep trying.
I say that all the time. I would love to not have to talk about any of these things, and people can just walk into the hospital and know that they're going to be supported. I mean, obviously I know out of hospital birth are options for people, but for people who either want to be in the hospital or need to be in the hospital, everyone should have all of these options available to them. So I'm like, I would be delighted not to have to talk
Yeah.
about these things anymore. Yeah.
But what a difference it would have made for me if a nurse taught me how to use the peanut ball.
Yes.
Is that, peanut shaped birth ball
Yeah,
to prop my legs open, because you can do a kind of squat in the bed while lying on your side. And there's all kinds of creative ways you can help someone with an epidural with the bed and the different
Absolutely.
positions it can get into. So
Absolutely.
it really was just it comes down to like nursing support, because the nurses in the United States are the ones coaching you through most of the pushing until
Yes. Yes. A nurse is so important. Who is
Or a
comfortable
doula,
with trying to,
but yeah.
Yes. It's so important. I will often say, like, literally millimeters can make a difference in terms of how a baby will fit through a pelvis, and you just have to keep moving and doing the things in order to try to get babies in.
Obviously was perfectly adequate for a 9-pound baby.
Yes.
So why did it take 3 hours to push out a 6-pound, 8-ounce baby? It was clearly the position was probably the problem.
Yeah,
and
absolutely.
So it was preventable. So yeah, I consented. I said, yes, you may do the manual, like using your hand to move the baby. And it was a bad experience, but I consented to it and I wanted her to do it. And then I consented to the vacuum. I gave my full informed consent, but I think those things were avoidable. Like, I don't think they had to happen.
Yeah, I agree.
So, and then the last thing I would say is if, you're planning on giving birth and you're interested in upright birthing. So I did a lot for my second birth of like visualization and rehearsing the position I wanted to give birth in. So I, during all my pregnancies, was always most comfortable when I was on my knees with my upper body draped over a birth ball. And that took the pressure off my back, and it just always felt so good on my hips and my back.
Right.
So I really wanted to give birth on my hands and knees, but with like my upper body kind of leaning on something. And so I spent a lot of time in that position towards the end of pregnancy, and I would kind of like try and do my deep breathing and relax. And I also visualized my baby coming out while I was in that position. So it really helped me, I think, prep for a completely different experience.
Right. I love that. So just as we wrap up, I ask all of my guests, what's the most frustrating part of your work?
Oh, I didn't know that this is a question you ask now. Probably continuing to hear the same complaints, 11 years after I started evidence-based birth. Yeah. And I do see a lot of improvement. I will say that. But I still get stories and I'm like, yep, it's still happening. And so, as I talked with you earlier about just like, the fact that we still have to talk about these things and try and like culture change is hard.
It is.
And that's essentially what, you and I are doing is we're trying to change the culture around birth to make it more supportive and have more options and choices and
more centered on the person actually giving birth.
Yeah. And I see improvement, but it's very geographic. You could have one place that's doing great and another place that's not. And so it's hard for families to, especially when they're blindsided and they didn't see it coming.
Sure.
And so I really, that's the hardest part. But the best part.
Yeah, I was going to say on the flip side, what's the most rewarding part of your work? The
most rewarding part is seeing the changes happening and more nurses, especially getting empowered. I think that 10 or 11 years ago when I started evidence-based birth, I think doulas were still an unknown group and they felt helpless in many ways in the face of all these challenges. But I think I see them feeling stronger now and, having more power because consumers really trust them. And so, I see a lot of improvements as well.
Yeah. So if you had to give one piece of advice to expectant families, what would that one piece of it, your favorite piece of advice be?
Oh, I always have more than one.
So. Okay, maybe two. How about that?
Probably if I could only give one, it would probably be to find a doula, because if you find a doula, they'll help you with the other pieces of advice, which I normally give as well.
Yes, that is true. Doulas do more than just support during birth. They help you during your pregnancy as well.
Yeah, they're resource mavens. They're kind of like, they know all the people and all the places and can connect you with what you need. Absolutely.
So then where can people find you and your resources and your book? Her book is great, you all. So where can people find you?
Yeah, so you can go to our website, evidencebased.birth.com, and we have a free crash course on how to get evidence-based care. And then we're on social media. We spend most of our time on Instagram at EBBirth. We also have a YouTube channel, and that is at Evidence-Based Birth. And then you can find my book on Amazon or Barnes & Noble or in our shop, and it's called Babies Are Not Pizzas. They're Born, Not Delivered.
All right. Well, thank you so much, Rebecca, for coming onto the podcast. It was great to have you back on.
It was an honor to be here.
All right. Let me